Welcome to the Pod of Inquiry. Ready for some thought-provoking cerebral whipping and the destruction of ridiculous medical dogma? Want to shift those stale, moldy old paradigms? Well then, don that thinking cap of yours. Get down in the cave and join our host, Dr. Stephen Barrett, for this week's episode. Let's start spelunking.
My guest today is Dr. Nishi Bhopal. Dr. Bhopal is board certified in psychiatry, sleep medicine, and integrative holistic medicine. She graduated from the University College Cork School of Medicine, completed her psychiatric residency at the Henry Ford Health System, and completed a fellowship in sleep medicine at Harvard Medical School. She is the founder and medical director of Pacific Integrative Psychiatry, an online practice in California where patients receive a whole person approach to anxiety, depression, and sleep disorders, including nutrition, psychotherapy, and integrative and functional medicine. In addition to her private practice, Dr. Bhopal is the founder of IntraBalance, an educational platform for physicians and health practitioners that includes a YouTube channel and online courses in clinical sleep medicine for practitioners and patients. Her passion is making clinical sleep medicine easy to understand and accessible to all. In this eye-opening episode, we'll explore some crucial aspects of sleep, such as the importance of sleep efficiency and how restricting time in bed can actually improve sleep quality for those struggling with insomnia. We discuss the complex relationships between caffeine, adenosine, and our sleep drive, and how this impacts our daily alertness and nightly rest. And we'd also talk about the often overlooked connection between sleep disorders and mental health. Please enjoy this wonderful conversation with Dr. Nishi Bhopal. All right, everyone, I'm here with Dr. Nishi Bhopal, and I think you're going to find this episode very interesting. It's about sleep, and I don't think there's anybody walking on the planet that doesn't need to sleep, right?
That's right.
Yeah.
But most of us are sleep deprived. So
that's right. So tell everybody a little bit about your background, how you got to where you are, your interests in psychiatry and your interests in sleep. How did that happen?
Well, when I was in medical school, I didn't set out to be a sleep doctor or a psychiatrist. I didn't even know that sleep doctors existed. Back then, sleep medicine wasn't really that popular of a field. I actually set out to become a pediatrician. That's what I wanted to do when I went into med school. But as I went through my rotations, I started to become really interested in mental health, in the intersection of mental health and physical health and the mind-body connection. However, when it came time to choose residencies, I ended up going into internal medicine. I started out doing IM because I felt like, well, it's a broad specialty and you get to do lots of different things. And I'm one of those people who's interested in lots of different things. So it kind of made sense to me to do that. But again, as I was going through my residency training, my intern year, I was really interested in how people were living their lives. Do you enjoy your job? What are your relationships like? What gives you a sense of meaning and purpose in life? And so it started to become clear that, well, maybe psychiatry is actually a better fit for me. And so I ended up switching into psychiatry after my intern year. And while I was doing my psychiatry training, I became really interested in sleep for a few reasons. One, I'd always struggled with being tired and sleepy. I was the student who couldn't get up for class on time, and I was like dragging in the morning. And when I was in university, I scheduled all my classes to be later in the day because I just couldn't make it to my morning classes, and I just couldn't get a handle on my sleep. And then when I was actually doing my IM intern year, a senior resident of mine was going into a sleep medicine fellowship. And I thought, oh, that's a thing? I didn't even know you could do that. And so she sort of introduced me to that, and I began doing rotations at my hospital where I was doing my training and became so fascinated because, one, I had my own personal experiences with sleepiness, but I was also seeing patients in the psych clinic who weren't getting better because they weren't sleeping well. Right. And once we were able to support them with restorative sleep, their mental health symptoms and their physical symptoms began to improve. So I saw firsthand how foundational sleep is to overall health. So
it sounds then like this was pretty correlative in the formation of your career, the sleep and the psychiatry. And It doesn't seem to me, because of just my limited knowledge of sleep specialists, like there's a lot of psychiatrists that are in sleep medicine. It seems like pulmonologists or some other specialty. Is it pretty rare for?
Yeah, it is pretty rare. It's so rare that, in fact, I did a sleep medicine fellowship after my psych residency. And when I came out of my fellowship, other doctors were telling me, no, you can't be a sleep doctor. You're a psychiatrist. Like, psychiatrists don't. And I'm like, well, I literally just did a year of fellowship training in it. So we do exist. And even then, like you were saying, most sleep doctors are pulmonologists or neurologists. The sleep field has been kind of dominated by those two specialties. But even then, there's so few sleep doctors to begin with, regardless of what their other training was. There's only about less than 8,000 sleep specialists, sleep doctors in the United States for a population of, however many millions we have now. So it's a ratio of about like 43,000 patients to every one sleep doctor.
Yeah. And in my 30 plus years of clinical experience, there's a handful of patients that I can think of when I've asked them, well, how do you sleep, that say absolutely fantastic. It's kind of like low back pain. When you ask them, hey, do you have everybody has low back pain. They live with it. Almost everybody doesn't sleep well, at least the folks that we've seen in the clinical setting, but even, just friends and colleagues. I mean, it's almost ubiquitous that this is a situation where it's more uncommon to have a great sleeper than a bad sleeper. You agree with that?
That's absolutely right. And in fact, the CDC has declared that insufficient sleep is a public health crisis because 1 in 3 adults in the US is sleep deprived for a variety of reasons. We can talk about some of those reasons today. Sure. But most of us are sleep deprived. I hear the same thing from people, like hardly anyone sleeps great. And again, there's lots of factors that go into that. And it has such downstream effects, right? So it doesn't only affect your day-to-day experience of being, tired, groggy, having trouble focusing, but it also can impact physical health. It has real metabolic downstream consequences, an increased risk of diabetes, increased risk of cardiovascular disease, increased risk of cognitive impairment in later age, mental health conditions, of course. So there's a bidirectional relationship between depression and anxiety, even, trauma and other mental health conditions and impaired sleep. But from a public health standpoint, I think about all these people who are driving on the freeway who are sleep deprived, right? Or they might have untreated sleep apnea and they're having these micro sleeps, falling asleep at the wheel. And in fact, AAA did a survey and they found that about 21% of fatal car crashes every year are because of drowsy driving.
Yeah, I think that, I don't know how long ago it was, but it was almost a trophy to carry around to say how little you slept, that you could be more effective, you were a better worker, your career was better because, I only slept 3 hours last night and I was up doing all these things. And then there was a shift. And what was that, about 15 years ago, 10 years ago, where they started realizing that, hey, sleep is one of the cornerstones of health and also significantly plays a big role in neurocognitive degeneration later in life. One of the greatest risks in Alzheimer's is impaired sleep for long, long periods of time. So did you notice that, like when you were doing your fellowship, that the tide was turning as how important, the perception of how important sleep really is?
Yeah. I noticed that as well. And I agree. I think it's about in the past 10 or 15 years that the attitude has shifted toward one of like, let's optimize our sleep. Let's get good sleep. You've got all these influencers now online talking about it. But even, when I was applying for my sleep medicine fellowship, again, when I was in my psych residency, I remember one of my attendings was asking me, so what do you want to do after your residency? And I said, I'm going to go do a sleep medicine fellowship. And he said, why would you do that? Our job is to help patients feel more awake, not put them to sleep. And I was thinking, well, isn't the connection obvious that if people can get good restorative sleep, they'll be more awake and alert and be able to live their lives to their fullest potential if they get good quality sleep. So that was the attitude that was around when I was starting out my training in sleep medicine. But yeah, it's completely shifted now in this modern day and age.
Well, I think a great illustration of that is the glymphatic system and how, I don't even know when the glymphatic system became known, but again, it wasn't that long ago. And, if you think about it, you can kill somebody with sleep deprivation in a very short amount of time. I mean, I think 7-8 days, it's very severe as far as normal metabolism is concerned. And I don't think there was this appreciation back in the day of how important sleep was from a metabolic and a physiologic point of view, that, you simply can't function as a human being without proper sleep, or at least maximally function without most improved sleep you can get.
That's exactly right. And yes, the glymphatic system was discovered like you said, not that long ago, just within, the past number of years, just a few years ago. And, we're starting to understand more about what happens during that, deep stage of sleep, which is stage 3, deep sleep. What happens with the lymphatic system is you get synchronization of these delta brainwaves that kind of wash toxins out of the lymphatic system. So those toxins include proteins like tau protein, like amyloid beta, that are implicated in the development of conditions like Alzheimer's disease. And what I like to emphasize to people is that sleep is not this passive thing where you go to sleep and you're in a state of oblivion for, 6 to 9 hours, whatever it may be, and then you're up and then you go about your day. Sleep is a very active process. Now, the process of falling asleep is passive. And so we can talk about that in the context of insomnia,
right?
Because when people have insomnia, they're trying to fall asleep, which is not actually effective.
Right.
But once you fall asleep, your brain rolls up its sleeves and it gets to work, and it does all kinds of things during different stages, including, cleaning out the brain, like we were just discussing. Memory consolidation happens during sleep. That includes like cognitive memories, if you're learning something, but also motor skills. If you're working on your golf swing, or, you're
right.
learning pickleball or something, right? All
right.
of these motor memories are encoded during sleep. Emotional regulation is really tied to sleep. And as you were saying, impaired or lack of sleep can cause all these sleep issues. It can be fatal. Sleep deprivation is a form of torture, right?
Right.
Yeah. So
Right.
it's really foundational.
So explain the glymphatic system a little bit for our lay audience, because actually explain it for everybody, because I talk to physicians all the time. They're like, what is that? But I think that's a really key thing, because the brain has to clean itself. So can you go into that a little bit more for them?
Sure. So so we basically have fluid. So, people have heard of the lymphatic system, right? So
Right.
that's kind of this fluid that we have in the body, and it's kind of like a cleaning system. It helps with the immune system, things like this. So we've got the same thing, but it's called the glymphatic system in the brain.
Right.
And so we've got this fluid in the brain. It's not blood. It's a different kind of fluid, and this also allows the transport of neurotransmitters and things like this. And so we've got these channels in the brain. And so what happens is at night, like during the day, we build up metabolites, right? So things like adenosine, and then these proteins that I was talking about. So what happens is at night, all of that gets flushed out through that lymphatic system. And it's thought that, and this is still a new idea, right? So there's even research coming out saying, well, does this actually happen during sleep? Maybe it doesn't. There is a research study that just came out on mice showing, maybe it's not exactly what we think it is. So stay tuned as we get more research on this. But the current thinking is that as we get these synchronized delta, which are these deep brain waves that we get on EEG during sleep, that actually literally pushes out all of this glymph out of the brain, and then it gets flushed out, and it helps flush out those toxins.
Yeah, I think you can find some very interesting YouTube videos if you take a peek with I think it's rats that they did the study where I guess they put some kind of a dye in the cerebral spinal fluid, and they were able to then see how it would come over the cortex of the brain, and then as the rat would hit the deeper stages of sleep, then there would be this seepage of the cerebral spinal fluid down through the brain, and I guess ultimately back into the CSF. And so I would think in light of those kinds of physiological studies, it'd be pretty hard to say that this doesn't exist.
Yeah, absolutely. And I think, sleep, I kind of think of sleep medicine as sort of like space exploration,
Right.
like the last frontier in medicine. There's still so much we need to learn about the human body and physiology and all of these things. But sleep is one of these areas, like we were discussing, that hasn't gotten a lot of attention. And it's sort of been like, the stepchild of medicine.
Right.
And, even in the medical community, people say, it's boring, or it's just sleep disorder. It's just sleep apnea management. Yet it's so much more than that. And we know that, sleep is a public health crisis, as we were talking about, but there's also over 80 different sleep disorders that have been described in the ICSD-3, which is the International Classification of Sleep Disorders. And when I ask doctors this, so I have a program teaching doctors about sleep medicine, and I lecture on it. And one of the questions I usually ask is like, how many sleep disorders are there? And usually I'll get answers like, I think there's 4 or 5, maybe 10. Well, there's actually over 80. And there's so much we just still don't know. And even when it comes to treatments, there's still a lot that's unknown. We've got medications that can be helpful for certain types of sleep disorders. We've got, CPAP and those kinds of treatments for sleep-related breathing disorders. But then there's this whole world of integrative sleep treatments that haven't really been studied enough, but that I'm seeing are having an impact with patients in my practice.
So let me ask you this, because when I looked at your website, you had some very interesting things on there. 2 things that resonated with me. One was that you look at these patients now from a functional medicine standpoint, and then also you talk about Ayurvedic treatments and that type of thing. So why did you end up going and gravitating into the functional medicine space?
Yeah, it's something that I was always kind of interested in. I just didn't have language around it. I didn't know there was such a thing as functional medicine, or
Right.
Or does that imply the rest of medicine is dysfunctional? I'm not sure. But really, what it is, it's just kind of looking at root causes. So, why does this person have insomnia? Why do they have restless leg syndrome? Why do they have excessive daytime sleepiness? And we have some answers to those that are available in conventional medicine, but functional medicine just goes a step deeper. Now, I'll preface this by saying I'm not a functional medicine practitioner. I'm not certified in functional medicine. I have taken courses in it, and I do use some of the elements that I've learned in my practice. And as far as Ayurveda, if anyone's not familiar, Ayurveda is the traditional system of healing that comes from India. It's over 5,000 years old. And it's so fascinating because they had such a sophisticated understanding of the circadian rhythm and sleep that is so aligned with modern circadian science and functional medicine as well, in terms of understanding the role of gut health, the role of light therapy, and all of these things that we're using now in modern medicine. So I draw from all of those elements when supporting patients.
Well, I think the one thing, and I've had the luxury to host some very prominent functional medicine specialists, and they are just different trained OB-GYN or internal medicine. And invariably, when I ask them that question, they will tell me that it's because what they were doing wasn't working. And you made the comment, which I thought was really very important, is that you try to find out what's causing the problem rather than just treating the symptom. So, you go to a busy internal medicine practice and you say, I'm not sleeping well. I guarantee you very few of those practitioners are going to try to dig down into why you're not sleeping. They're just going to say, okay, here's a prescription for Ambien or whatever the drug of their choice is for that, and see you later. And that doesn't really do much for long-term benefit for the patient, in my opinion.
That's exactly right. And that was also one of the reasons I started getting into integrative medicine and functional medicine, is because those treatments really aren't all that helpful. And in fact, they can be harmful in the long run. And, now I have a program teaching physicians and other clinicians about integrative sleep medicine because there is such a knowledge gap. I don't like to blame the practitioner. That's all they knew. That's all they were trained in, is prescribing those meds. And most doctors in the US, and actually studies have shown that this is true kind of around the world as well, most doctors only get about 1 to 2 hours of sleep education during their training. But every single patient, every single person has to sleep, right? So there really is this gap. And the treatments that they learn are, they're usually like using Z drugs or hypnotics or using other types of medications like trazodone. And with the Z drugs and hypnotics, they can actually cause more sleep issues long-term. People can develop a tolerance to them. They can get rebound insomnia when they stop. So if they miss a couple doses or they decide to stop, their insomnia can come back worse than it was before. So they can start to have worse symptoms than they experienced before they even started the treatment.
So let's say you have a patient that has a high component of, let's say, general anxiety disorder. Obviously, they're probably not sleeping very well. How do you look at that? You try to manage the anxiety so that they can sleep, or you try to optimize their sleep so that they become less anxious? Or do you do both?
Yeah, so it's really a multifactorial approach, right? So I like to figure out, okay, what's the low-hanging fruit here? When it comes to sleep specifically, there are a few mistakes that I see people making all the time that are really common for people who are struggling with insomnia. So let's say, insomnia is defined as difficulty falling asleep or staying asleep at least 3 nights a week for 3 months or longer. So let's say the person is having trouble falling asleep. One of the biggest mistakes I see people making is they go to bed earlier, hoping they're going to get more sleep. So, oh my gosh, so much trouble sleeping last night. So let me go to bed tonight at 8 p.m. and maybe I'll get a little bit extra sleep. But what that does is it creates this Pavlovian response where now your brain is trained to be awake and anxious in the bed. So one of the first things I do is really work on those sleep behaviors so that we can reduce those negative associations and improve the patient's sleep efficiency. And that also takes the anxiety out of sleep as well, because we're trying to take the pressure off of trying to sleep and shifting the focus to relaxation and calming the nervous system. Now, if they have a lot of daytime anxiety as well, then of course we need to address that. And there's different areas that we can focus on there. Sometimes medications are helpful, right? So I don't want to send this message that, nope, we should never use medications. Sometimes they can be helpful, but there are so many other things that we can do to help regulate the nervous system. There's things we can do with regard to blood sugar regulation, nutrition. There's supplements that can be helpful as well. Circadian regulation is a big aspect also. So I like to look at all of these different factors.
Right. So what's your thought process on sleep monitoring? Because when I started getting into the biohacking world about 5, 6, maybe a little longer than that, 7 years ago, there was 4 cornerstones, basically. One was sleep, exercise was the other pillar, nutrition, and then spirituality. And I think you can't have one without the other. Obviously, the human won't function. They have to have all 4. But one of the things that I've always noticed with my patients is that if I can give them a metric, I don't care if it's their A1C or their serum fasting insulin level or whatever, if they're able to have something that they can monitor, then that gives them it's a little bit more of an impetus for them to maybe get into the treatment plan that you're kind of laying out for them. And one of the things that I adopted very early on was the Aura Ring. And I have no financial interest in the Aura Ring other than I think it's great. I use it every day. I've played with other monitors like the Whoop and some of these other things. But by and large, the Aura seems to have a pretty nice analysis now. What's your thought process on that and helping you maybe actually, if a patient brought you, like, here's my sleep scores for the last 30 days, can you take a look at it? Would that help you with your diagnosis? Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called Stem Regen, which I take daily and genuinely believe could revolutionize your health journey as well. Stem Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. Stem Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once unleashed into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating Stem Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that Stem Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co/Dr. Steven, that's with a PH, and use the code SBPOD to get a 15% discount off your first order of Stem Regen.
Yeah, so I like monitoring, and I'm saying this as I'm wearing my Oura ring. So we're Oura ring twins here.
Yeah.
So yes, so I do like tracking, with the caveat that for people who have really significant insomnia, sometimes tracking can cause more anxiety for them. And so there are cases where I might say, you know what, let's just stop tracking for a few weeks and just tune back into your body. Because one of the patterns that I do see come up with people who have a lot of anxiety is now they're solely relying on the output from their wearable to tell them how they feel. And they lose touch with their actual system and their body and, their emotions and all of these things. And so wearables are a great adjunct. And I like to look at some of the metrics like heart rate variability, and some of the patterns that we see on Oura Ring. We're looking for that hammock-shaped pattern with the HRV. That's a sign of, good resilience to stress. So I do like to look at that. Of course, I like to look at their sleep duration, their sleep efficiency, all of those kinds of metrics. The sleep score I kind of take with a grain of salt because, I don't really know what goes into the algorithm there. So I like to look at some of those other metrics that are easier to really hold on to. And the other thing that I like to look at, or I tell people to take with a grain of salt rather, not like to look at, is the sleep staging on the Oura Ring. And most of these wearables, you take that with a grain of salt because I'll have patients come to me saying, oh my God, I only got 12% REM sleep, or I got only 5% deep sleep. And these wearables are not really that accurate yet at detecting sleep stages. So I tell people, don't even worry about that. Let's just focus more on the HRV and some of these other sleep efficiency metrics and things like this.
So let me interrupt you real quick, because just for people that don't know what HRV is, can you explain that a little bit to them, and the parasympathetic versus the sympathetic aspects and how it relates to not only sleep, but overall health?
Yes. So we've got two aspects to our autonomic nervous system. These are the parasympathetic nervous system, which is the rest and digest aspect of our nervous system. And then we've got the sympathetic nervous system, which is the fight, flight, freeze, and fawn response. So HRV, or heart rate variability, refers to these tiny little variations that we get between heartbeats. And when you have a little bit more variability, it's easier for your body to respond to stress, right? So if you're in your parasympathetic nervous system state, you're going to have a higher HRV. So we want that heart rate variability to be on the higher side. When you're in a sympathetic nervous system state, so let's say you've got chronic stress, or you're worried all the time, you've got a lot of anxiety. When your body's in that stressed out state, that variability between the heartbeats actually goes down, and so you get a lower variability, you get a lower HRV. So when I'm looking at these metrics on the Oura Ring or whatever wearable the person is using, we're looking for the patterns, not the overall HRV number, because everyone is going to be different. So it's not helpful to compare it to your spouse. Like, oh my gosh, my spouse had an HRV of like 80 and mine's only 50, right? So that's not really a useful comparison. We're really looking at the person's individual trends over time, right? So you want to just be comparing to yourself. Now, we do know that when people have a lower HRV, they're more likely to experience symptoms of anxiety. People with depression are likelier to have a lower HRV, and then other health conditions. So cardiovascular disease, metabolic diseases, there's a whole host of other things that are associated with low HRV. Now, is that a cause of those issues, or is it a symptom? There's kind of a more complex relationship around that. But in psychiatry, we even have methods that are based around HRV biofeedback to help people with anxiety and stress, really training your nervous system to be more resilient using HRV as a marker.
So HRV is kind of interesting because I know when I monitor mine, if I have a glass of wine less than 3 hours before I go to bed, my HRV plummets. It just does. And so it's kind of cool to see those things because, like you say, it's not fair to compare your HRV to your spouse's HRV because they are kind of an individual metric. But I think if you look at it from an individual standpoint, it can help you shape your behaviors a little bit. And the same thing goes for eating right before you go to bed. At least for me, my heart rate variability drops tremendously, just like if I drink a glass of wine half an hour before going to bed. So it's kind of interesting. So are you able to get some insight and work with the patient when you're doing some of the, let's say you're doing non-pharmacological therapy for a patient, because I'm really more interested in that because I think that's really where the secret sauce really is. But do you work on maybe trying to optimize their HRV and different methods to do that?
Yeah, so it's really fun to do that, actually. And as you were saying, the nice thing about using these types of wearables is that you can get that data and see how things affect them, because everyone's different. I'm like you. If I eat too close to bedtime, then my HRV goes down. And I know that. The other thing that impacts my HRV is using screens right up until bedtime. Like, I see the impact. And then when I don't do those behaviors, then I see the improvements in my HRV. So that is something that I like to look at with patients as well. But again, everyone's different. So I'll have some patients where, if they go too long before, between eating and going to bed, like if they haven't eaten for several hours, sometimes that has the opposite effect on their HRV. Right? So they might struggle more with sleep because of maybe a drop in blood sugar that occurs during the night. And that might contribute to issues with staying asleep, issues with waking up in the middle of the night, or even waking up with a panicky type of feeling. So in those cases, we might modify and have them have a high fiber snack about an hour before they go to bed, and then track how that impacts their sleep. Now, again, with a lot of the patients that I work with, they have a great deal of anxiety and insomnia related to that. And so in those cases, I might not have them track again, because I want them to have a little bit of ease around their sleep, right? And to build that confidence around sleep. So this is where I'm going to bring in techniques from CBTI, or cognitive behavioral therapy for insomnia, which is the first line gold standard treatment for chronic insomnia as recommended by the AASM, the American Academy of Sleep Medicine. And if we are tracking, I usually recommend tracking for no more than 2 weeks at a time, just to get a sense of what's going on with your sleep pattern, but then taking a break from tracking and then implementing some of those other techniques.
So what are some of the other techniques that you like to use?
Yeah, so one of the biggest ones is called sleep restriction. And I actually I say that name with hesitation, because I don't like the term sleep restriction. Okay. Because it implies that you're restricting your sleep. And in fact, it's actually time and bed restriction, also known as sleep efficiency training. So I know that my biohackers that I work with, they like that term, sleep efficiency training, better. So essentially what this is reducing the amount of time a person is spending in bed closer to the amount of time they're actually sleeping. So for example, we're tracking this marker called sleep efficiency, which is a marker of sleep quality. So sleep efficiency is basically the percentage of time that you're sleeping in your bed. And an ideal sleep efficiency is somewhere between 80 to 90%. So around 85% is kind of considered ideal with that range. So for example, if someone is spending, let's say 10 hours in their bed, but they're sleeping for only 6 of those hours, that's a 60% sleep efficiency. And it's really hard to force your brain to sleep longer, but it's easier to just cut down the amount of time that's being spent in bed.
Right.
So if they're only sleeping 6 hours, I might have them just spend 6.5 or 7 hours in bed max. And then we'll track their sleep efficiency. This is one of the best treatments for people struggling with insomnia or poor sleep quality, with a few caveats that I'll share in a minute.
Okay.
And in fact, this technique called sleep restriction or time in bed restriction is shown to be effective as a standalone component of CBTI. So people can just do this. And I teach physicians how to do this, like those internal medicine docs or psychiatrists who, they feel like they only have Ambien or trazodone in their toolbox.
Right.
I'll teach them how to effectively use sleep restriction therapy with their patients. And oh my gosh, it's like, it can be literally night and day for patients. It can have such a profound impact in just a few days. Now,
Go ahead, but I'm going to ask you, after you finish on that, I'm going to ask you about naps.
Yeah. Okay, great.
Okay.
I just wanted to share a couple quick caveats with sleep restriction training. One is it's not to be done if someone has untreated sleep apnea.
Okay.
So we always want to rule out sleep apnea as a cause of insomnia or poor quality sleep. And this is a huge topic. Like sleep apnea is another public health crisis. So many of us are walking around with no idea that we actually have sleep apnea, and it can happen in all ages, all sizes, all genders. It's not just in the overweight male with the 17-inch neck. That's the classic archetype. It can happen in all people. So sleep restriction training, not to be done if there's untreated sleep apnea. If there's treated sleep apnea, then yes, you can do it. And also to be really careful with people who have medical conditions like bipolar disorder. It can trigger mania in some patients. So use caution for any psychiatrist listening, use caution with those patients. And then also caution in patients who have seizure disorders. Aside from those patient populations, it's generally safe and effective for most people.
So what about naps?
Okay, I love naps. I love this topic. I'm a huge fan of naps. And there's a few considerations when it comes to naps. Okay, so a short nap, like a power nap, like 20-minute nap, is shown to be really effective for alertness in the afternoon, for improving cognitive functioning, for improving memory and attention. And in fact, many large companies like Google, Huffington Post, Ben & Jerry's, NASA, they all have nap pods in their offices, not out of the goodness of their heart, because they just want people to rest and relax, but because they know the impact and the research on productivity that comes with these short power naps. So a short nap, 10 to 20 minutes in the afternoon before 3 p.m. can be really helpful. For anyone struggling with insomnia, though, I do not recommend taking a nap, because when you're struggling with insomnia, it's like you're not hungry for dinner, right? Like you're not hungry for sleep when you go to bed. And having a nap is like having a snack before dinner. If you're already not that hungry, now you're having a snack, you're going to be less hungry at dinner time. So a nap is like a sleep snack. So for people with insomnia, don't have a snack before bed, right? Don't have a nap.
Right.
For anyone else, naps can be incredibly restorative. Now, there are some people who feel like they might need not a 20-minute nap, but a 2-hour nap in the afternoon. I have patients like this, and that could be a sign that either they're chronically sleep deprived, and so we really need to work on getting them enough sleep at night so they're not needing these really long naps. It could be recovery. So of course, if you're sick, you have COVID or something, then of course you're going to need those longer naps. So that's fine in those situations. But then it could be an indication that there's some other sleep disorder going on, like sleep apnea, like restless leg syndrome, or something else that's disrupting sleep.
Right. So one of the nice things about the Aura is that it will show you your heart rate and how so you can see those days that you don't have great sleep, your heart doesn't really quiet down. And correlatively speaking, your heart rate variability is not very good usually as well. One of the things that I've seen in my personal maintenance of sleep is that if I have very good exercise in that day, then I tend to have better sleep that night. It's the off days that I have harder times getting to sleep.
Yeah, that's exactly right. And so exercise is one of the best things that people can do to improve sleep quality. Exercise helps to improve sleep drive, increase the sleep drive or that sleep hunger that I was talking about. So we can use those terms interchangeably, sleep drive and sleep hunger.
Right.
And so with sleep drive, it's related largely to a neurotransmitter called adenosine. So
Right.
adenosine builds up during the day and it makes us feel sleepy. So the more adenosine we have built up, the sleepier we're going to feel at night. And while we sleep, the brain washes out that adenosine, like we were speaking about earlier.
Right.
So exercise helps to drive up that adenosine and help us feel sleepier at night. Now, I'll have people ask me like, well, what if I exercise in the evening because I'm working all day, I don't have time for a workout, and I want to do my workout at night? Is that going to negatively impact my sleep? Well, there was a study recently looking at this, and they found that vigorous exercise within 1 hour of going to bed has a negative impact on sleep. It can make it harder to fall asleep and stay asleep. And that may be related to changes in core body temperature, because we need a reduction in core body temperature by 1 to 2 degrees Fahrenheit to fall asleep and then stay asleep. So you want to avoid vigorous exercise. Vigorous exercise meaning it's hard to talk, so like
Right.
you're exercising and it's hard to hold a conversation, that's considered vigorous. Then don't do it an hour before bed. But mild to moderate exercise, even an hour before bed, is not shown to have such a negative impact on sleep. But again, it really goes back to the individual, and that's where tracking can be helpful, because then you can see, well, how does it actually impact me? Because it might affect you differently versus your neighbor.
So talk about adenosine a little bit more, because I think it's a molecule that gets pretty affected by different agents that we take into our body.
Yes. So the big one here is the relationship between caffeine and adenosine.
Uh-huh.
So as I was saying, adenosine is this neurotransmitter that builds up and it makes us feel sleepy. And so what happens is you get buildup of the molecule, and then it binds to a receptor. And so when the adenosine binds the receptor, it tells your brain, okay, you're sleepy now. And we need that sleep drive. It's called process S. So we need this process S to fall asleep at night. But many people are using caffeine to stay awake and alert during the day, or they might just enjoy it. I have patients who are like, I just love my morning espresso. I love the ritual. I love the flavor. So we really want to pay attention to how caffeine is affecting you personally, because the way that it works is that the caffeine molecule looks very similar to the adenosine molecule. So caffeine binds to the adenosine receptor, and it prevents adenosine from then sending that signal to the brain that you're sleepy. Instead, caffeine is binding, blocking the effect of adenosine. So this is why you get, you see the lineup at Starbucks around the corner at 2 p.m. when people's adenosine levels are high, and then they get this natural circadian dip in the afternoon. So that's when you might want to take that power nap. But this is often when people will reach for that second cup of coffee or third, or however many they're having. And that caffeine is blocking adenosine from having a signal. And then the half-life of caffeine is different for everyone. It's long.
Right.
It's long. It's like anywhere from 6 to 12 hours. Some people are slower metabolizers. So that means they might still have caffeine in their system, well into the nighttime hours, well into their sleep zone. And that adenosine is not able to do its job. But here's the other thing that happens is when people are using caffeine, the adenosine is still building up in the background, right? So it's not like you're getting rid of that adenosine. That only washes out during sleep. So then you can get this chronic sleepiness. People can get into this cycle of like, oh my God, I'm so sleepy and tired all the time. I need my coffee to function. The adenosine's still building up. Now their sleep is impaired, that they're not getting enough sleep, and it becomes a vicious cycle.
That's so interesting. There are so many facets to this. It's such a complex, and I think what makes it really difficult is to really effectively, and this is my opinion, but to really effectively treat a sleep disorder, it takes a lot of work on the patient's behalf as well as the physician's behalf.
This is something I talk about all the time, that, as the physician, you can't be working harder than the patient.
Right.
That's something we say in psychiatry all the time. Don't work harder than the patient, because sleep, and this is kind of, there's pros and cons to this, right? Because sleep is really in your hands. As the person who wants to whether you want to optimize your sleep or you're struggling with a sleep disorder, you have the power to make these changes. And even simple things like this time in bed restriction I was talking about, minimizing caffeine, exercise, getting out and getting bright light, they sound like such simple things where people are like, well, that's not really going to work. Well, it does.
Right.
But it takes consistency. Now, we also don't want to forget about sleep disorders. And so for people who are doing all of this stuff and it's still not helping, that's where we want to maybe do some testing to see what else might be going on.
So, yeah, and I think this is, we've been in that magic pill scenario for decades where the patient wants to lose 50 pounds and so give me my semaglutide. And it's not about making maybe better choices and increasing exercise or all of the things that go into it. But really, if you want to optimize from a human physiology standpoint, it's more than just a script pad and a cursory look and say, okay, here's a pill for you. That's never really going to be optimal in any form. I mean, maybe in an infection, yes, give them an antibiotic, but you know what I'm talking about. So if the patient comes to you and they're willing to work and buy into this, then I think it's really just a matter of education. You educate them, and you're like a coach, right? A coach will rarely engage an athlete that's not motivated. You can't be a great coach if you don't have an athlete that's motivated to be a great athlete, right?
That's exactly right. And, I've even, now that I have my own private practice, when I was working in other groups, I didn't have a lot of say in the patients that I was working with. Now that I have my own practice, I'm very clear with people about, look, I'm not prescribing you Ambien.
Right.
That's not what I'm here to do. And if you want to taper off, if you've been prescribed it and you want to taper off of it, we can do that successfully. Or if you are really ready to engage in other things, let's work together. And I really see it as a partnership, as a collaboration with the patient, because everybody's so different. And there is no one size fits all approach. And this is where this Ayurvedic or functional medicine approach comes in, where, I like to really start with some basic lab work to make sure we're not dealing with simple things like a vitamin D deficiency. There was a study showing that people with vitamin D levels less than 20 were like, I forget the statistic. I think it was like 60% more likely to experience sleep issues, something like that.
Right.
I'm also looking for iron deficiencies, low ferritin, which is implicated in restless leg syndrome, but also just restless sleep. And I see this all the time. Or things like vitamin B12 deficiency. So simple nutritional things, we start with looking at those. I'm always thinking about sleep disorders. And, is there some kind of sleep apnea or something else going on? And I'll show you this device that I have here. This is the sleep image ring. I don't know if you've heard of this one.
I haven't.
Okay.
All right.
So I'm just showing the sleep image ring. This is not a consumer grade device. This is a professional grade device. So it can only be prescribed by a sleep doctor. And it's different than an Oura ring. So Oura ring, we talked about the metrics that it looks at.
Right.
This can be used as a screening tool for sleep apnea, diagnostic tool. And so I work with a company called Empower Sleep. And so we use the sleep image ring. And so, I might have patients do this for, 7 nights. You can do I think they can do up to 100 nights of testing with it, which is really different than a lot of the home sleep devices on the market where you can only do like 1 or 2 nights.
Right.
This really gives you some nice longitudinal data. So I'm always looking at those kinds of things and then really partnering with the patient to see, okay, where do you want to start? One of the most effective things to do to start with is to have a consistent wake time to regulate the circadian rhythm.
Right.
But just to your point that there's so many different things we can do, and it's really up to the person to decide what are they willing to engage in.
So when you look at a patient, they come to you for primarily a sleep disorder, and you're trying to get their HPI to figure out, because these folks are not, none of them fit into algorithms, right? I mean, because they're all different. They all have different, let's take a patient, for example, that has to work at night 2 nights a week. And now that's messed up the other 5 nights. So it's not like these are real easy cases that can be just treated via an algorithm, because the patients don't fit into that. So I think it's probably pretty important to get metrics like you just showed with that, because like you say, they don't know that they snore or they have sleep obstruction throughout the night. And without all this data, you look at their labs and all this other stuff, it's impossible to really craft a great treatment plan otherwise, in my opinion.
It's exactly right. And this is where people end up being prescribed sleep aids that really aren't all that helpful for them and actually are not indicated and could be harmful for them. I remember a teenager I was working with in the sleep clinic. So I worked in a sleep clinic and I was covering the other doctor's patients that day. And there was this teenager who came in and he had been prescribed Ambien, and he had been on Ambien since he was in high school. And I was like, what the heck? Like, oh my goodness. And that really gets my alarm bells up, because I'm like, why is this young person who's only, I think he was in college, maybe 19 or 20, why is this person on Ambien every single night? And when I took the history, it turned out he actually had a circadian rhythm issue called delayed sleep phase syndrome, and more common in younger adults and adolescents, but you can see it in older adults as well. But he had a circadian rhythm issue, and you don't treat that with a sleep aid. But because he just didn't have anyone who had the time to really go into it with him, he ended up on this prescription drug. And he was so relieved when I told him what was actually going on, and that we had a plan now to taper off, and we had a plan to use bright light therapy and strategic use of low-dose melatonin, also optimize some of his nutritional aspects and gut health. And this young kid, he was just so happy that, oh my God, I don't have to take this medication for the rest of my life. So, these are powerful and life-changing interventions for people.
Right. Well, it's almost like you have to train us how to sleep.
Yeah.
And I mean, you can think about it from a breathing standpoint. There's a lot of merit to breath work, but we're not trained in breathing. And I remember one day I had read something, and then the follow about nose breathing versus mouth breathing and how it affects nitric oxide production. And I thought, well, this is pretty astounding. Nobody ever told me to shut your mouth and breathe through your nose, right? And so I was in surgery the day after I'd kind of come across this, and our anesthetist was from Nepal. And I asked her, I said, did they teach you how to breathe? And she said, oh yeah, it was part of our kindergarten. They trained us how to do breathing through our nose. And I'm going, wait, because I hadn't told her anything about what I had read the day before. And I thought, this is really very interesting. But I guess my point is that these things like sleep are not always just intuitive, that patients don't know how to really go and manage it the best.
Yes. And you're right. We don't learn how to take care of our health, really. We don't learn how to sleep. We don't learn how to eat. We don't learn how to breathe. And this is why, there's so much wisdom in these ancient systems like Ayurveda, traditional Chinese medicine, because they truly are holistic, and they do talk about those things. They do talk about how to live, really. And of course, we've got all the advances of modern medicine and modern science that they didn't have back then. And so what I really like to do is blend the best of both worlds. We use the modern science, and then we rely on that ancient wisdom for more of these kind of holistic practices. And our society is set up to make us not sleep. Mm-hmm. In fact, I think it was the CEO of Netflix that said that his greatest competitor is sleep. So right. All of these systems have been designed to keep us watching, keep us binging, keep us scrolling, keep us engaged, keep us distracted.
Right.
And sleep is usually the first thing to go out the window.
Oh, I have like 100 more things I could ask you, but I'm going to have to bring you back for another episode because I'd love to get into a little deep dive on sleep apnea because it seems like that's an epidemic right now. But we're getting close to the time where we got to kind of shut down. But before we do that, the one question I have is that, and patients will ask me this, it's like, well, I have to pee at 3:00 in the morning. And once I get up and then I go back to bed, my feet are starting to burn because I have neuropathy, or I start thinking about things because I got all of these things on my mind. Do you have any little biohack tip for maybe that?
Yep, definitely. Okay. So number one, sleep apnea.
Okay.
Right. So waking up at night to pee can be a symptom of that. Not always, but it can be. So I'd rule that out. Number two is to minimize any light exposure that they're getting when they get up to use the bathroom. So use a little night light. Maybe that's an orange or red tinted light instead of turning on the bathroom light, because that's just going to wake up your brain. So
Right.
Do that. And then if they're finding that their brain is kind of active now that it's the middle of the night, what I recommend to everyone to do is a technique from CBT, cognitive behavioral therapy, called scheduled worry time or a brain dump. And you do this during the day. So you just take a pen and paper, 5 minutes, set your timer for 5-10 minutes during the day, and you just write out all the things that tend to swirl around in your mind at night. And that way you're giving your brain dedicated time to focus on that stuff. And so it's less likely to come up in the middle of the night. And then the last thing is think about that time in bed restriction. Sometimes it's just that you're in bed for too long and now your brain is kind of, your sleep efficiency is decreasing. So you can think about restricting that time in bed and see if that helps.
Oh, that's very interesting. Wow, what a wealth of information you have provided us today. Tell the folks how they can get a hold of you. And also, for a lot of the physicians, they're probably going to want to take your mini course that you talk about. So just before we shut down, to talk about that for a second. Tell us how we can get that.
Thank you. Yes. So if people want to work with my team one-on-one, we see patients in California by telehealth. That's at Pacific Integrative Psychiatry. So you can go to pacificintegrativepsych.com to learn more about that. Then I've got a platform called IntraBalance, and you can find me on YouTube at IntraBalance, INTRA Balance. And I have courses for physicians. I also have a course for patients who just want to kind of, get some guidance on this. It's a self-guided program. And you can find all of that at my website at intrabalance.com.
Nishi, thanks so much. Really appreciate you coming on. And I look forward to having you teach us more.
Thank you for having me.
And now a message from our sponsor. Well, folks, if you're over 40 and you're not using a supplement to augment nitric oxide production, you should really rethink that. This molecule is absolutely imperative to health, not to mention the cardioprotection. Nitric oxide is a physiological molecule that does so many things for your health. I never miss a day of nitric oxide supplementation. That's how important it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, just go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration, and I am certain you will be pleased not only for yourself, but for all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see that nearly every one of them will be deficient. When they see this result, they will want you to start them on it immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates. Thanks for watching. You can start today.
I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex. Please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.